I moved to Fresno for the cheaper cost of living and to get another degree at Fresno State. I've been a paralegal at big law firms in the Bay Area, most recently in Silicon Valley. I envisioned myself being housed and stable and having employment and getting another degree at Fresno State. And I had a long goals list, and nowhere on that was my epilepsy coming back that I've had since the age of 6. I'm on powerful anti-seizure medications, and they prevent me from working. I can't show up for employment because I sleep a total of 17 hours a day. And it is just, the disability has really reared its ugly head, and it has really impacted every area of my life. I had to move out. I couldn't get employment because the medications are so powerful that they cause this enormous level of fatigue. You know, in the beginning I was very angry with God. I was very angry having to go through Paralegal and all the shelters, and you know, I used to work with billionaires in Palo Alto who were tech founders of companies and Stanford graduates, and I thought my whole life was planned out. You know, I just thought, you know, boom, 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 I'm going to accomplish all these goals, and never did I see a major health problem derailing my whole life and my goals list. Never saw it coming. I've met a lot of people in our shelters and living in their cars and on the streets who are like me, the new demographic that University of California at San Francisco describes, that we're 48% of us are over the age of 50, 90% of us were born and raised in California. We've worked and paid taxes, and we are new to homelessness, and we have been sheltered most of our lives. Then I've met other people who were in the foster care system, had horrible childhoods, you know, parents that weren't there for them. You know, there's a variety of people. I've met the mentally ill, of course. I've met homeless veterans who have war trauma, and we don't have housing for them and services. So it's really a whole demographic, but the largest percentage I see are people like me who've worked and now have major health problems, and we don't have enough facilities for them. We don't have any facilities for them. We're 40 years behind on building affordable housing. Shelters require that those of us like me as an epileptic with that if you have a medical problem, you have to sleep on a bottom bunk, but they don't have enough bottom bunks for all of us with medical problems. So we're left out on the streets to fend for ourselves. I'm not a street person. I don't know. I didn't know how to survive. It was very dangerous down by Paralegal. And so as a woman, it was very dangerous for me as a woman. Any woman's in danger. So what I did is I went to the thrift store, and they have an entire section of scrubs for sale, used scrubs. And I checked, you know, I just observed the hospitals and what scrubs they wore, what different employees wore in the color of scrubs. And then I bought used scrubs from the thrift stores, and I wore scrubs that matched the hospital colors of employees. And then I slept in my car in hospital parking lots so that I would blend in. I think we need to have certainly a big change in government policies. I think that we need to have housing built, whether it's tiny homes on foundations like Oklahoma does, Pivot for foster youth, or it's Veterans Community Project in Kansas City, Missouri for homeless veterans, our men and women veterans. I think that we need to come together as a community and build housing.